I'm Habib Samadi. I'm professor of medicine at Emory University School of Medicine, and I'm director of interventional cardiology at the Emory Heart and Vascular Center. Microvascular disease in the heart refers to diminished or abnormal small blood vessels in the muscle of the heart. And so microvascular disease refers to some restriction or disease in those small blood vessels, limiting the blood flow to the muscle of the heart.
My name is Joan Yankee, and my condition involves a problem with my heart. And if it wasn't for the problem with my heart, I would consider myself to be very, very healthy. And then as my condition worsened to the point that I spent most of my day in bed or on the couch, my doctor back in South Carolina, Dr. Balknight, and my other medical friends told me that it was time to get out of town. I needed to get someplace, a center of excellence for heart care that could help try to figure out what was going on with my heart. What's unique about Emory is that they know this dysfunction very, very well. They know it in a mild presentation form, and they also know it the way that I have the dysfunction.
The actual treatments are common garden variety treatments that we also employ for patients with tight blockages or atherosclerosis. Again, the challenge is you have someone whose angiogram looks completely normal, and oftentimes physicians might say, you know what, these symptoms are not related to your heart, when in fact they are, and they're related to these areas that are difficult to assess. But once you assess it and you make the diagnosis, then the treatment are pretty common treatments. As we mentioned, these are drugs that are used in common day practice of cardiology to treat coronary disease.
I'm very much recognize how lucky we are to have the collaborative spirit and working together that we have with Emory. They leave their egos at the door and they work together to help Joan.
I think one of the advantages of our approach is that the community physician can tap into this pool of expertise. And so all this group that we discussed in this multidisciplinary approach to preventive cardiologists, the non-invasive cardiologist, interventional cardiologist, the psychologist, all of them work together and interact with the referring cardiologist or the referring internists in the community to take care of their patients. I think what makes Emory unique in this field is, number one, the passion that we've developed in taking care of these patients. We've realized that oftentimes a lot of these women are very active women who've led extremely productive careers, who suddenly hit a wall. And exactly what happens to their microvasculature and their vessels is not known, whether it's some kind of viral insult or some kind of toxin or some kind of hormonal and metabolic derangement. But again, these are very active women who suddenly find themselves completely incapacitated.
One of the things with Emory is a very open sense of being able to ask questions, get them answered. They understand that I may have some fears about this, and even though they give me no false hopes, they're there and standing by me as I go through this process.
I think one thing that's extremely satisfying about this condition and this patient population is that one can utilize 20, 30 years of scientific research in vascular biology that's often done in cell cultures and experimental models, and bring that knowledge and those diagnostic tests to the bedside and identify some of these patients that have microvascular disease and endothelial dysfunction, and then try to help them not only in their symptoms and their outlook, but also in their lifestyles. And it has been satisfying to work with these patients, and really they've been very inspiring to most of us.